Today marks a significant moment for the people of Migori County as we make history in medical service delivery. Being a peripheral county, which is quite distant from the major cities, where the hub of medical diagnostics are domiciled, the people of Migori have been suffering since independence due to lack of access to fundamental diagnostic services. The launching of a computerized tomography scan, normally abbreviated as CT scan, today here in Migori County is a serious and magnanimous step in medical service delivery in the county. For instance, before such strategic interventions, the county has been referring any basic case of CT scan and magnetic resonance imaging, or normally abbreviated as MRI, to establish facilities mainly in Moi Teaching and Referral Eldoret, Kisumu, Ijabe, Tenue, and recently Kisii Teaching and Referral Hospital, but at very, very extremely high cost. So, just to appreciate the kind of high cost we are talking about, a unit cost of referring one patient to the nearest facility in Kisii is at least Kenya shillings 16,000, and it is broken down as follows. Kenya shillings 8,000 goes to CT scan cost, and Kenya shillings 8,000, another 8,000 are for referral and ambulance services. So in a month, if 20 cases are referred to Kisii, for example, it would translate to Kenya shillings 320,000 per month, or 3.84 Kenya shillings per annum. This was a huge loss to the county, not only in terms of resources, but it was also a serious parameter of inefficiency in desired medical service delivery. In some cases, ladies and gentlemen, lack of CT scan services often led to mortalities and morbidities. This in itself is against the tenets of access to cheap and affordable quality medical services as is envisioned in the universal health coverage or that universal health coverage idea. So allow me to observe, ladies and gentlemen, that the CT scan that we have come to launch here today has a cost attached to it, and the cost is Kenya shillings 235 million. And part of that cost includes a warranty for all the parts for 5 years. The parts will be repaired whenever there will be breakdowns, and all the equipment will be up to date, whether they are the ACs, whether they are the generators, whether they are the UPSs, the laptops, or the internet charges, the building maintenance, training, and proper servicing that will be done twice per year. So all those are built into the final cost of 235 million. And we are all aware that the counties are running some programs under the least medical services. So allow me to observe, ladies and gentlemen, that today is indeed a turning point to the people of this county. It is an end to the long sufferings that my people have been enduring. The center is intended to significantly reduce turnaround time with extremely huge cost reductions and excellent returns. With this unit in place, I would only but strongly encourage the residents of Migori to register in large numbers into the NHIF or into the NHIF service in order to reduce the unnecessary heavy load of out-of-pocket expenditures while seeking for medical services. This shall significantly reduce the otherwise high disease burden in Migori County. Allow me also, ladies and gentlemen, to appreciate sincerely my staff. I think that the staff in the Department of Health have made the whole county proud. They have made good progress. They have given it a new hope, and it is my prayer that the staff will still strive to do their best to uplift this facility to greater heights of development. So, besides the CT scan, ladies and gentlemen, my government has also funded the construction and installation of a state-of-the-art medical laboratory at a cost of Kenya shillings 65 million. And I want to appreciate the support we have also been receiving from our development partners. For example, here, I want to appreciate AMREF under the Global Funds that they gave us an additional Kenya shillings 29 million, and that one has been earmarked for the medical laboratory to improve the laboratory building and to install a molecular biology equipment such as polymerase chain reaction, early infant diagnosis machine, and ELISH test machine. So those are very, very vital equipment that will really improve our status. Now, the county government has been referring such diagnosis at enormous cost to Ampart Chemistry Lab in Kisumu for analysis. But I'm happy to report that we are no longer going to do that because the equipment are readily here, and even the staff to operate and do the analysis and also here. Now, in terms of the ISO certifications, some people call it ISO, but allow me to call it ISO certification. Yeah, I think that is the proper, it's not ISO, but it's ISO. Yeah, those are standards. And we have standard number 15189 of 2012. So in terms of that certification, our lab is ISO 15189 2012 certified. And I want to say that it was the first of its kind in this region. So from 2016, our lab was the first one to receive that certification in this particular region. So, my dear people, our development record in medical service delivery is quite elaborate and impressive. For instance, it might interest you to note that we have also installed an excellent oxygen plant here in our referral hospital at a cost of Kenya shillings 45 million just in the last financial year. Before this wonderful intervention, ladies and gentlemen, the Department of Health had been inevitably purchasing and transporting oxygen from BOC in Kisumu at very, very high cost. That is why it gives me maximum pleasure today to also preside over the launching of Migori County Oxygen Plant, which is capable of filling one oxygen cylinder in an hour. And one oxygen cylinder It's not just those ordinary small cylinders that you normally see displayed along the seas. Ours are cylinders that are weighing 11 kilograms. So 11 kilograms of oxygen gas, pure and clean oxygen gas, is what we are able to generate in an hour. So we have reticulated the oxygen into all our wards, hence making it suitably accessible to all our inpatients just at the head of their beds. The plant is not only capable of serving us here internally, but it is capable of producing enough to be sold to other needy and deficient areas. So it will be like an income generating activity to the county. And I'm happy that very, very soon we shall be exporting to our neighboring counties. It is an excellent value for money investment. Now, ladies and gentlemen, to meet the target of the universal health care, my government has also invested a total of Kenya shillings 68 million to construct a maternal, child, and amenity complex in the referral hospital fitted with a modern maternal theater. This is one of our key flagship projects, which is meant to completely change the phase and mode of medical service delivery in Migori County. I want to report that on completion, that we envisage to be in 2 months' time, our maternal and child indicators are bound to significantly increase. And those who would like to maybe see what I'm talking about, if you can throw your eyes just behind me, you will see some huge building with some blue roofing. So that is what I'm talking about, and I hope that very, very soon, maybe in the 2 months that I've just talked about, we'll be coming here for another big launching ceremony. See you at Now, ladies and gentlemen, besides the amenity or private wing, which will be fitted with ultra-modern equipment and hospitality facilities to address the urgent needs of our executive medical services, I want to say that Migori will be the envy of many, many counties. Because now, some of us, when we fall sick, we fear to be admitted here. So I really want to persuade you that don't go very far. That healing or the curing, that is making you to spend a lot of money, you will just get it here. We have, and very soon we will be having almost everything within ourselves here. So the struggle and the trouble will be gone. Allow me to take this opportunity once again that we want to sensitize, and I want your cooperation in this, to help me in sensitizing the residents of this county that they don't need to go very far. We have everything here. But of urgency, help me to persuade them to register in large numbers for the NHIF scheme or any other relevant medical insurance cover that will make them maximize on the services that we are offering here at reduced cost. Now, if all those things are done, ladies and gentlemen, what we expect is that the lost glory will be brought back, and that our Migori Teaching and Referral Hospital, currently referred to as level 5, will be among the best to be promoted to those higher levels of hospitals. Now, in this financial year, that is 2019-2020, ladies and gentlemen, the Department of Health has prioritized the construction of an intensive care unit complex with a modern emergency care unit, which is relatively comparable to what one would expect to see at the Kenyatta National Hospital. The complex shall greatly improve on medical service delivery and significantly reduce on referral and ambulance services, which have been so heavy to bear by the health department as they offer the desired medical services. Before I conclude, ladies and gentlemen, I want to appreciate one of our partners, and with their help, they are called Tupime County Program. So with the help of the Tupime County Program, the Department of Health has developed the second County Health Sector Strategic and Investment Plan 2018-2023 and a corresponding health sector monitoring and evaluation plan. These two key documents signify a roadmap towards the achievement of our goal of a healthy and productive population. They are linked to the County Integrated Development Plan 2018-2023. They are also linked to the National Health Sector Strategic Plan and the medium-term expenditure framework budgeting process of the county government. The strategic plan focuses on the following. 1, expansion of health infrastructure, where we intend to upgrade Migori County referral to a teaching and referral hospital. Kuria West to a level 5 hospital, and 14 hospitals to the requisite level 4 status, and the upgrading of 24 dispensaries to health centers or status. The plan also focuses on the recruitment and retention of human resources for health, and it also lays a lot of emphasis on quality and affordable health services, adequate essential health products and technologies. Last but not least, there's a heavy focus on health information, that is computerization of the 14 hospitals. So, my dear people, I'm well aware that Migori County still lacks key medical specialists, such as pediatricians, physicians, radiologists, among other specialists. And that is why the acting CS was making a very, very passionate appeal to the Speaker so that they speed up the process of vetting and clearing the board so that the board can conduct for us interviews and we get the required personnel to man our necessary health units. I want to say that for the success of medical service delivery, staff and key staff, the specialists that I've talked about are key pillars. Without them, we may not do much. So I want to confirm to the members of the public that in terms of budgetary provisions, we have set aside around 10 million Kenya shillings that will be used towards the recruitment, placement, and engagement of those key staff that I've just mentioned. And allow me also to note, ladies and gentlemen, that for the success of all that we have witnessed here today, team spirit is very, very important. We cannot work in isolation. So it is my appeal to you, as members of Migori County, as workers of this facility, as stakeholders of this facility, that let us embrace one another for the success of our medical service delivery. If we want our people to benefit, kindly let's pull together. Because together we stand, but divided we fall. I think that should be the spirit. Yes. Now, we need, in working together and for the success of this facility and the programs, I call upon each and every one of us here to show a high sense of responsibility and accountability, and even initiate that team spirit, if it cannot be initiated by your brother or sister. Be the change agent, and I hope it will work for us. Now, finally, ladies and gentlemen, it's now my pleasure and pride to officially launch the Migori County Health Sector Strategic and Investment Plan 2018-2023 and the Health Sector Monitoring and Evaluation Plan. And all these are to the service of the people of Migori and to God the Almighty. Is the Migori County Department of Health Services Monitoring and Evaluation Plan 2018-2023. Happy Makofi. The blue document here is our Health Sector Strategic and Investment Plan 2018-2023. Now, we are having a handshake here with the CC member for health so that everything will be peaceful, isn't it? Yeah, we need the handshake for peace here. So, wagonjwa hawezi pona kama hatuna amani hapa. So, lazima tuwe na amani hapa. Si namna hiyo?